morning.
Good morning.
My name is Connie. I'm one of the nurses here at Rasmussen, and I'd like to perform a head-to-toe assessment on you. Okay? I'm going to wash my hands and provide for privacy. All right. Can you verify your name and date of birth for me?
12/20/97, Haley.
Okay. And do you know where you are right now?
My house.
Okay. And who is the president?
Joe Biden.
Okay. The patient is alert and orientated ×3. General posture is good and overall appearance is good. And we're going to start at your head, and I'm checking for any bruises, any lesions, any spots of hair, any parasites, and that looks good. Okay. You want to remove your glasses for me? Thank you. Okay. And can you look over my shoulder at the wall? Eyes open. Okay, you see the tip of my pen? Okay, follow that in. Okay, good. And then I'm gonna keep looking straight ahead, and good, and good. Cranial nerve 2 is intact. Okay, now stare at the tip of my pen and only moving your eyes and not your head. Follow my pen light. Okay, cranial nerves 3, 4, and 6 are intact. Okay, and now I'm going to check your ears for any drainage. Okay, and then if you can turn your head this way, good. Let's see what else, good. Okay, and then look straight ahead. Can you hear this? And can you hear this? Okay, cranial nerve number 8 is intact. And now I'm going to check your nose for patency. Do you have a cold or any trouble breathing? Okay, and breathe normal. Good, and this side. Good, and your nose is centered in line. You can put your glasses back on if you want. Okay, and then if you can open your mouth, I'm going to check your mucous membranes. Stick your tongue out for me. Okay, uvula is middle, and can you swallow for me? Okay, good. Stick your tongue out again. All right, your tongue is midline. So cranial nerves 9, 10, and 12 are intact. Okay. I'm sorry, remove your glasses. I'm gonna check your lymph nodes. These are your auricular, occipital ones. Here's the mandibular, your tonsillar, your preauricular, your post-auricular, your anterior cervical, post-cervical, and your subclavicular. Okay, you can put your glasses back on now. Okay. And I'm going to listen to your lung sounds. Normally I would be doing the skin to skin. And also checking respiratory rate, rhythm, depth, and if there's any use of accessory muscles. Okay. Every time you feel my stethoscope, take a deep breath for me, okay? Okay, good. If I can have you stand up for me. Okay. Okay, good. Don't sit down yet. Okay, I'm also gonna check her spine for alignment. And then if you can take a deep breath for me, I'm gonna check your thoracic expansion. Okay, one more time. Okay, expansion is equal. You can have a seat back on the bed. Okay, and now I'm gonna check your carotid, one side at a time. Sorry if my hands are full. Okay. And I'm going to listen to your heart sounds. Again, this would be done skin to skin. Starting first at the right second intercostal space, the left intercostal space, and the third intercostal space, the fourth intercostal space, to the fifth intercostal space, midclavicular line. Okay, good. All right, and if you could lay down for me. And then skin to skin also for assessing bowel sounds. I would first look at her abdomen to inspect it. I'm going to auscultate for her bowel sounds starting in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Bowel sounds are present in all 4 quadrants. Do you have any difficulty using the bathroom? No pain, no discolor when urination? Okay, and how about when was your last bowel movement?
Last night.
Okay. And no urinary incontinence when you try to get up and go to the bathroom? No? Okay. Okay, and next I'm going to feel for your pulses, and first I'm going to assess the skin, make sure there's, checking for temperature, pallor, make sure there's no swelling. Going to palpate the right brachial artery, the right radial pulse, brachial pulse and the right radial pulse. And then check cap refill, which is less than 2 seconds. And then same thing on the other side. The left brachial pulse, left radial pulse, and cap refill. Okay? And then if you can take your hands and squeeze my fingers at the same time, go ahead and squeeze. Okay? Strength is equal on both sides. If you can uncross your legs for me. Skin to skin, I will be checking the right popliteal pulse, the right post-tibial pulse, the right dorsipedal pulse. And skin to skin, I would be checking her cap refill and assessing her legs for tenderness, warmth, pallor, and any edema. Same thing on the left side, her left popliteal pulse, her left post-tibial pulse, and her left dorsal pedal pulse. And checking cap refill on that. And then also checking for color, any swelling, and any abrasions or anything on her legs. Okay, now I want you to take just your toes and pull them up towards your head. Okay, and then I'm gonna have you push on my hands like a gas pedal. Okay, good. I'm pulling back up. Okay, good. Strength is equal on both extremities. Okay, and then if you can stand up for me. Okay, take a couple steps towards me. Okay, good. And then you can go back there. Thank you. And then I'm gonna have you face me, put your arms straight out. Okay, palms up and close your eyes. Okay, good. Romberg's test was negative. You can open your eyes and then put your arms out to the side and do a circular motion. Good. And then arms back down your side and then shrug your shoulders. Okay, good. Again, smile, do it again. Okay, good. And while I touch the side of your face, turn that way, good. Same resistance on the side, good. That's cranial nerve number 11, which is intact. And then again, can you feel this? And can you feel this? Okay. Smile, frown, puff your cheeks. Very good. Cranial nerves 5 and 7 are intact. Okay. Very good. Thank you. You can get back in bed as long as you're comfortable. All right. And thank you for letting me do your head to toe assessment on you.
No problem.
And I'm going to wash my hands. And that completes my head to toe assessment.